The problem is that we have this drug resistant bacteria called superbugs. All of us have read and heard about them. They're becoming harder and harder to treat because we lack the new antibiotics capable of combating these infections. It's actually scary when you think about what's happening in many facilities across our country. And so it's obviously crucial that we find new antibiotics that are discovered so that we can stay ahead of this growing trend of drug resistance. Drug discoveries obviously don't happen overnight, and action is needed now to ensure that we have access to these life-saving medications when we really need them. These are serious infections. They are definitely life-threatening to the patients, especially children and the elderly. In fact, the CDC, the Center for Disease Control, has named these antibiotic resistance as one of the top public health concerns in our country. According to the Infectious Disease Society of America, 100,000 deaths and 360,000 hospitalizations result from antibiotic-resistant infections each year in the U.S. In my state of Tennessee, nearly 2,000 cases of MRSA are reported annually. MRSA is a common and very dangerous type of antibiotic-resistant bacteria, often found in the hospital setting. And again, all of us know of cases, I'm sure, where this has happened to loved ones, friends, and others. The financial impact of these infections is also staggering, costing our healthcare system $35 to $45 billion annually. This problem is also threatening the health of our troops abroad. One particular type of bacteria, known as Iraqibacter, is striking hundreds of wounded soldiers coming back from Iraq. Since 2003, more than 700 U.S. soldiers have been infected or colonized with this life-threatening bacteria. While bacteria infections continue to become more resistant to traditional antibiotics, the innovation of these new antibiotics capable of combating these infections have slowed at an alarming rate. FDA approval of these new antibiotics has decreased by 70% since the 1980s. Between 2003 and 2007, there were 5 new antibiotics approved by the FDA compared to 16 new antibiotics from 1983 to 1987. What this bill does, the GAIN Act, provides meaningful market incentives and reduces regulatory burdens to encourage the development of these new antibiotics that will help us save lives and reduce health care costs. Specifically, and I really appreciate the way the senator from Connecticut has approached this. Specifically, the bill provides 5 additional years of exclusivity to new drugs developed to treat these superbugs. The bill also gives these antibiotics priority status during the FDA review process so that they can move more quickly through, and encourages the FDA to revisit their clinical trial guidelines for antibiotics. By encouraging a more robust antibiotic pipeline, we can help ensure that patients have access to life-saving treatments while also reducing health care spending. The GAIN Act is a straightforward, common-sense bill that provides market incentives to encourage innovation without putting federal dollars at stake. Antibiotic resistance is a growing issue that we must address now to properly prepare for the future. Dr. William Evans, the director and CEO of St. Jude's Children's Hospital in Tennessee, recently wrote a letter supporting this bill, and all of you know of St. Jude's and the wonderful work that they do for children across our country. Here's his quote: "We don't want to find ourselves in a situation in which we have been able to save a child's life after a cancer diagnosis only to lose them to an untreatable, multi-drug resistant infection." I'd like to thank my colleague again, Senator Blumenthal from Connecticut, for his leadership on this bill, and I look forward to working with him to ensure it gets proper consideration in the Senate. I'd also, Mr. President, like to ask for unanimous consent to submit letters of support into the record from the following organizations: St. Jude Children's Hospital, Bonheur Children's Hospital, University of Tennessee Health Sciences Center, East Tennessee State University Quillen College of Medicine.